Welcome to the next rhythm challenge. So here we have 4 different options and we have our rhythm strips in front of us. Okay, so again, you want to name the following rhythm, choosing the best of these 4 answers. Okay, the choices are A, sinus bradycardia, B, atrial fibrillation, C, wandering atrial pacemaker, or D, multifocal atrial tachycardia. Okay, so 2 rhythm strips. Okay, again, we are to have these rhythm strips from our standard 12 lead. These are lead 2 in V1, okay, lead 2 on inferior limb lead. In lead V1, a short axis view of the right anterior portion of that heart. And then we have the enlarged portion of those rhythm strips above, just so you can see those small boxes if you need help in looking at the regularity or with the rate. Okay, so what I want you to do is pause the video, take a moment to look at it, choose the best answer, what you think is right on your own. When you're ready, restart the video and we'll go through it together. All right, so hopefully you had a chance to go through this and give it a shot. So let's go through these one at a time. Again, we not only want to know what is the right answer by just simply moving on, but we want to be able to know why we chose the right answer and why the other ones are not correct. Okay, we always want to understand why we see what we see on the ECG. Okay. So let's get started. Let's go with choice A, sinus bradycardia. So we have 2 leads here. We don't have the full 12 lead, but these are rhythm strips taken from them. Okay, so what can we tell about sinus bradycardia? All right, well, there's a few things. Remember that sinus bradycardia has P waves in it, okay? And then when we look at lead 2, remember they're upright P waves. They have the same morphology throughout, okay? In lead V1, we would see these biphasic P waves sometimes, okay? In those biphasic P waves, that first portion represents the right atrial depolarizing, that latter terminal portion left atrial depolarization, okay? The other thing we have to know about sinus rhythm is that it's often a regular rhythm, okay? Unless you have a sinus arrhythmia or a block, okay? But normally, sinus rhythm, in this case, we'll consider a regular rhythm. Bradycardia, what does that tell you? That tells you that the rate is slow, and we'll say less than 60 beats per minute, all right? And again, we are always assuming adult patients unless I indicate to you otherwise, all right? So those are the key concepts for what we need here. Now, next we have atrial fibrillation. Do we have P waves? No. There are indiscernible P waves, meaning we cannot see clear P waves in atrial fibrillation. Okay, the atria is firing chaotically. You don't have true atrial depolarization waves that are seen on the surface ECG. Okay, so no clear P waves, but what's a big clue that's going to help us out? Okay, it's the irregularity of the rhythm. This is the most common irregular rhythm. Okay, and how about the rate? Well, in this case, it doesn't say if it's slow or fast, so typically between 60 and 100 beats per minute in adults. Remember, when we have a fast rate over 100 and it's an atrial fibrillation rhythm, we call that atrial fibrillation with rapid ventricular response, or AFib with RVR. When it's less than 60 beats per minute, we call that atrial fibrillation with a slow ventricular response. Okay, that's in our adults. Next, we have wandering atrial pacemaker. Okay, so this has P waves, but what's going on here is that you have ectopic foci in the atria that are firing. Okay, so they're not all coming from the sinus node. You have atrial pacemakers within the atria that are firing, okay? And because of that, we're going to have at least 3 different P wave morphologies, okay? And because we have 3 different P wave morphologies, that means they're arising from at least 3 different areas in the atria. If we have 3 different areas in the atria that are starting our impulse, we're going to see is at least 3 different PR intervals, okay? So the time that it takes to get to that AV node and conduct through is going to be different, okay, because of where that distance is from where that ectopic foci initiates. The other thing you want to note here is that this is an irregular rhythm, okay? So I put this here because often we just think of atrial fibrillation as it, but this is one that you want to also keep in your mind if you see that, because again, you have different areas in the atria that are just picking up and then they're still conducting through. And because of that, it can be irregularly irregular. All right. Next, the other thing you have to know here is that the rate is less than 100 beats per minute. And why is that important? Well, it's important because that's what differentiates this C, wandering atrial pacemaker, from the following, MAT, multifocal atrial tachycardia. Okay, so with multifocal atrial tachycardia, again, you have at least 3 P-wave morphologies. Okay, again, you often have 3 different PR intervals. You have an irregular rhythm. But what's the differentiating factor? The rate is over 100 beats per minute, okay, or at least 100 beats per minute. So it's a tachycardia. That's something that should clue you in, all right? So 100 beats per minute or more, that's multifocal atrial tachycardia. Now, wandering atrial pacemaker, less than 100, you think of that, okay? So these are the differentiating clues between those 2 rhythms, okay? And notice that all B, C, and D are irregularly irregular, okay? So when you think of an irregularly irregular rhythm, I don't want you to always think of atrial fibrillation. Keep other things in mind, okay? And why do we say that? Well, when we look at our rhythm strips here, notice that, what do we have here? What are all these things that I am highlighting? These are all P waves, okay? We'll do it the same thing in V1. These are all different P waves that we're showing that you see down here. Okay, so 3 or more P waves. Okay, and so because we see P waves, we can automatically tell you that B is incorrect. Okay, now how about sinus bradycardia? Is that correct? Well, so first let's look at the regularity of the rhythm. We're kind of getting ahead of ourselves. So regularity of the rhythm, meaning if we look at our intervals, okay, and you can either do the R to R interval, okay, or you can do the P to P interval. And maybe the P to P interval is a little more accurate, but it's sometimes hard to make out where that initial portion of that P wave is starting from, because if you already noticed, some of those P waves look different, okay? So if we use our R to R interval, okay, throughout, so this is our R to R interval, and you would take that one and measure the next one, okay? If you were to do this throughout, you would notice that they're not all the same, but they do somewhat appear somewhat regular, okay? But in fact, this is, again, an irregularly irregular rhythm. This is not a regular rhythm. And if you weren't convinced there, then the thing you should look at are the P waves. And what we already mentioned is that notice that this P wave here, okay, looks different from this P wave here and this P wave here, okay? And if you were to look through, you'd see a number of different P waves. So I've already circled at least 3. Okay, at least 3 different P waves that we see here. So sinus rhythm is not correct. Remember, normal sinus P waves have that upright morphology in that, okay, in lead 2, and they have the same morphology. They're originating from the sinoatrial node or sinus node. Okay, and you may wonder, why do I say a P wave is present here? It looks like there's nothing there. Well, look right below it. What do you see here? That's a P wave. Okay, so always look above and below if you're not sure if there's a P wave. Okay, so if you look down here, we said this is a P wave. Okay, if you look down below it, you can see the P wave. Okay, a biphasic P wave. Okay, and it's hard to tell the difference in morphology of those biphasic P waves because they almost look the same. So as you can see, lead 2 is better here in differentiating that. Okay, so sinus rhythm is not correct. Atrial fibrillation is not correct because, again, this is P waves are present. Okay. Now, we said this is a standard 12-lead ECG rhythm strips we're looking at. So we know from beginning all the way to the end represents 10 seconds, okay? And 10 seconds times 6 is 60 seconds, which is 1 minute. All right, so far so good. Next, we know because of that, if we count the number of complexes, we'll put in that box. If we multiply it then by 6, we can get an estimate of the rate in beats per minute. Okay, so let's find the ventricular rate. Let's do that here. Okay, so we'll use 1, 2, 3, 4, 5, 6, 7, 8, 9. So you would do 9 times 6, and that's 54 beats per minute. 54 beats per minute is less than 60, so it's a bradycardic rate, okay? But this is not sinus bradycardia, so don't get tricked that this is sinus bradycardia because we saw different P wave morphologies, okay? Instead, we see at least 3 P wave morphologies, okay? And notice that we have at least different PR intervals, okay? So if you look closely, you would see that there's different P wave PR intervals, but I don't want you to get caught up on that. I want you to focus more so on the P wave morphologies, okay? But it's sometimes easier to see, but I don't want you to focus on these PR intervals. Focus on the different P wave morphologies. We said it's an irregular rhythm, despite a little hard to see just based on the naked eye, so using and measuring that out would be helpful. Okay, so the differentiating thing between this is that it's less than 100 beats per minute. It's not a tachycardia, okay? Which, because of that, that means CWAP, or wandering atrial pacemaker, is the correct answer and not multifocal atrial tachycardia, okay? So hopefully that makes sense, okay? Again, just to recap, sinus bradycardia is not correct despite it being a slow rhythm because, again, we need a regular rhythm that has normal P waves have the same morphology throughout. It's not atrial fibrillation because clearly we see those P waves present there, okay? It's not multifocal atrial tachycardia because the rate is less than 100 beats per minute, okay? Despite it having at least 3 P wave morphologies, as we saw here, and it being this irregular rhythm. So it's this portion here that weighs it out. And I want you to remember that so you can differentiate these in the future. Okay, so the answer here is choice C, wandering atrial pacemaker. Well, that's the end of this lecture. I hope you learned something.